I'm ready when you are.
Everybody ready? Good evening, I'm Gail Newell, Health Officer for the County of Santa Cruz. As of 4 p.m. today, Santa Cruz County has 11 cases of COVID-19, 9 confirmed by testing, and 2 presumed because they're close contacts of known cases with symptoms. Many more tests have been performed with pending results. We have been severely limited by the inability to provide testing and suspect that the number of cases is far higher than 11. Community transmission is occurring at a moderate risk in Santa Cruz County. Global examples have indicated that we should expect to see a doubling of cases every 6 days unless we take measures. This would result in a steep curve of disease transmission. It will take each and every one of us to protect our community. Today at 1 p.m., the health officers of the 6 largest Bay Area counties issued a joint order to shelter in place, effective 3/17/20 at 12:01 a.m., extending for at least 3 weeks. In consultation with and with the support of our county leadership, I have issued the same order for Santa Cruz County. Confirmed cases in California now number 530, with over half of them in the Greater Bay Area. Santa Clara, our neighboring county, is the epicenter of this outbreak in the Bay Area. Many of our residents commute to Santa Clara County for work or school, and many Santa Clara residents visit Santa Cruz as well. We're a few days behind Santa Clara in disease activity, but our per capita rates are not very different. So now is the time to take action. What we're trying to protect is the healthcare delivery system. We can't allow it to become overwhelmed, or the consequences for all of Santa Cruz County residents will be difficult. This is true whether you have coronavirus or not. It's best that we act now and take aggressive action than to be too slow and allow this disease to overwhelm us. We would rather overreact than underreact in this circumstance. I want to stress that these measures are temporary and subject to revision. They're a change to people's routines, but life will return to normal. We have notified our law enforcement partners and are working with local service providers to assure that our low-income and vulnerable populations are protected. We will have more on that in the coming days. I'd like to thank our residents, local businesses, community partners, political leaders, and especially our healthcare partners for their support. There is a lot of fear and anxiety in our community, and fortunately for the vast majority of us, COVID-19 does not pose a serious threat. In most cases, the disease is mild and most people will recover. However, for a small percentage of our population, our elderly and medically fragile residents, this order is about protecting them. It's about saving lives before the virus can threaten them. Thank you.
Talk about enforcement if you could. How will this be enforced?
I've been speaking with the sheriff through the weekend and working with the police chiefs as well. And we can't enforce every detail of this order, of course. The orders are enforceable by law. At this point, we're mostly looking out for tomorrow and St. Patrick's Day gatherings. We really want to prevent any large gatherings of folks for St. Patrick's Day.
Will people be arrested if they're not complying based on the way they're gathering and things they're doing?
People could be arrested, but we're certainly hoping that our community members will voluntarily abide by these guidelines.
And will the enforcement be a little bit of a slow rollout, or basically, essentially starting tomorrow morning?
Starts tonight right after midnight, effective then.
And if people are arrested, what statute could they be arrested for, and would it be a misdemeanor? Do you have that information?
I do not have that information.
Okay. And just to follow up, is our order the exact same as the orders that we've seen in these 6 other counties? Are there any differences between Santa Cruz County's order and those other 6?
There are very, very minor differences in wording, nothing significant.
Not in terms of what activities are prohibited or allowed?
They're the same. Would you like me to give a summary of what's in the orders? Okay. So the new orders direct all individuals to shelter at their place of residence and maintain social distancing of at least 6 feet from any other person when outside their residence. The order outlines circumstances under which people may leave the residences and defines essential activities, essential government functions, essential businesses, and essential infrastructure. A few highlights. People experiencing homelessness are exempt from this order, but are strongly urged to obtain shelter, and governmental and other entities are strongly urged to make such shelter available as soon as possible. All businesses with a facility and all businesses with a facility except essential businesses are required to cease all activities beyond minimum basic operations. All essential businesses are strongly encouraged to remain open to the greatest extent possible. Essential businesses shall comply with social distancing requirements, including when customers are standing in line, so 6 feet apart. All public and private gatherings of any number of people occurring outside a household or living unit are prohibited with limited exceptions, and all travel except essential travel and essential activities will be prohibited. Mass transit will remain open. People may use public transit only for the purposes of performing essential activities or to travel to and from work to operate essential businesses, maintain essential government functions, or essential infrastructure. This order will take effect tonight, as I mentioned, and a reminder that health services will remain open, grocery stores will remain open, pharmacies will remain open, food can be ordered from restaurants, delivery or carryout, gas stations, banks, and hardware stores will remain open, essential government services and essential infrastructure will continue to operate. The rules are complicated, but they're very carefully delineated in detail in the order itself.
So for some of these smaller businesses, can you kind of clarify, is it that they're just supposed to stop business, or what does that mean necessarily to I guess, continue at a minimal level?
That would mean that they do what they need to do to maintain the very basics of their business, but they're not open for business unless they're providing an essential service.
Okay.
Dr. Newell, why was this decision, I know this is following the Bay Area a little bit, but do you know why the decision was made to do this today and to enact this starting tomorrow?
I was planning to issue a health officer order today with limited restrictions around mass gatherings and social distancing at any rate, with prohibiting any mass gatherings 50 or greater and social distancing for groups of 10 to 50. In anticipation of St. Patrick's Day, the 1918 flu epidemic hit a peak after the St. Patrick's Day parade in New York City, and so it's kind of a landmark as something we want to prevent happening with COVID-19.
So as far as being arrested too, I'm just curious, is this just for the bigger gatherings for St. Patrick's Day, or is this something that could continue on throughout the time of the shelter in places?
This is in effect for the next 3 weeks at least, and we will reassess as things develop.
And that's just for like big group gatherings, for things like that, correct? That's not if, I don't know, somebody's out late past a certain time trying to go get gas for whatever reason.
Correct. There's no curfew hours listed here. But when people are out, we are expecting them to social distance, so 6 feet apart whenever possible. so people can go out and walk their dogs, take a walk, ride their bike, get outdoors, help relieve some of that stress, but we want it to be done individually and not in groups as much as possible.
With the social distancing, what about, does that apply to housemates, right? So, you know, couples walking their dog together, are they expected to stay 6 feet apart? Is there anything, what would your guidance be for housemates?
Household members are already fairly close contacts and very close contacts in most cases, and in those cases it would be safe for them to be together.
And just to follow up on that, so there's a long list of things that are exempted from this, but I'm imagining people are going to have a harder time knowing, other than, you know, crowding into bars and restaurants, what is not allowed that they normally do, you know, making an individual social visit, things like that. Can you outline some of the common activities that are not allowed under this order?
I think that if you can refer folks to our website to look at the actual order itself, it's really clear and detailed and explains itself. And that can be found on our public health website, so santacruzhealth.org/coronavirus, and it's right at the top, highlighted in large print.
But making a one-on-one social visit would not be allowed. So getting into your car, going to a relative's house for a non-essential reason, is that not allowed under this order?
That is not allowed under this rule. There are some exceptions. For example, if you need to take care of someone's pet, or if the person that you're traveling to has needs that need to be met that they can't meet themselves.
Are bars, wineries, brew pubs, are they allowed to stay open? What's the status there?
Again, it depends if they serve food, and we specifically do want restaurants to stay open for folks that otherwise are unable to cook their own meals for a variety of reasons. So restaurants, we want them to continue functioning and deliver or provide to-go food. And in some cases, if there's food through those kind of situations, then they would be encouraged to stay open and continue to serve.
And then you mentioned the homeless population and that people, that they should seek shelter, people should give them shelter. To what extent is the county involved with providing emergency shelter, be it in hotels or trailers or anywhere else, for the homeless population?
We're working really hard at that. We have a large group of people working through that and making some good progress, and we have some definite plans in place.
Is part of the goal with the shelter in place to avoid having to do a lockdown, essentially?
It's a kind of a friendly way of doing a lockdown, right?
So I guess how much more extreme is, say, what's happening in Italy, or is a lockdown actually, versus shelter in place?
Well, at this time, that's not indicated and wouldn't be helpful because our neighboring counties are in very similar situations to ours, so it's not going to make a difference one way or another.
But it's fair to say this is definitely not as extreme as
this is not a lockdown.
Is there any precedent for this in Santa Cruz County or even beyond, or is this entirely unprecedented to your professional knowledge in this county and even beyond?
There has been nothing like this since World War II, is what I'm told.
We weren't around in 1918. Anything else? All right.
Do we know how many test kits are currently available in the county?
I don't. I know that there's 3 commercial labs who are running tests now, in addition to the public health lab in Santa Clara County that continues to do testing for us as well.
And for the elderly and for people who have chronic conditions and aren't able to cook for themselves, is the county involved at all in trying to ramp up meal deliveries for people in those states?
Yes, we're actively working and planning on meeting the needs of our communities as they're, sorry, it's distracted. Yeah, so for example, Gray Bears was considering stopping their services, and we intervened and said, no, this is the time that we need you to ramp up your services, and so they're increasing their numbers of volunteers and numbers of deliveries to folks who can't leave home.
One other area that occurs to me is just in terms of reporting what you would want to see from residents or advise residents to do if they're being asked to go into a job that they believe is non-essential, if a business that they interpret as non-essential is remaining open or they're aware of these activities, should they report? And if so, how?
I would
don't
call
have an
it
answer to that.
non-emergency police number if you want to make a report on that. That's happening in other counties, and so we are getting those questions though.
And then just the last one last question for me on testing, just pulling back into the bigger picture. So there are commercial tests happening. There are the tests that your department is involved with happening. Can you summarize the efforts to try to stay on top of how many tests are being done and what those look like? Because I think the big question that I'm sure you want to answer and people want to answer is what ratio of people being tested are testing positive. That would tell us a lot. What do you know about that right now, and what's being done to try to get a handle on that question?
The public health department is copied on all of the lab order forms that go to the commercial labs, and so we get all the results back, whether negative or positive. So that way we can look at both the positive and the total numbers ordered, which would give us that ratio. We have been running about 1 in 6 tests are positive.
And so you would have then a total number of tests, right? Is there a total number of tests that you are aware of based on those reports?
Not since commercial labs started. So we have just begun getting the first results from commercial labs. So the figure I quoted you about 1 in 6 was only from the public health lab.
Yeah, I just kind of want to put a finer point on that because a lot of people in the community are worried they have it or think they have it or are calling doctors' offices or showing up at hospitals. So there was a strict screening criteria because of the limited number of tests. And even those that went through the strict screening criteria, 5 out of 6 are still coming back negative.
Fortunately.
Fortunately. But we do believe there's more out there in the community than we're currently showing.
But is that test number a number that you would hope to be able to provide in the days or weeks ahead? I mean, should we be able to arrive at a number of tests that have been done, and is that something that you would plan on releasing?
For Santa Cruz County residents, I hope that we could get that number, but I'm not sure that we will. It's voluntary whether the negative results are sent to us, and if we rely on our colleagues to make sure that they're copying us on their order. Maybe the commercial labs themselves will be releasing that kind of information.
Thanks.
And then it was 9 confirmed cases, and the other 2 just showing symptoms.
The other 2 are presumed cases because they're both close contacts of confirmed cases, and they have symptoms consistent with coronavirus.
So you're still waiting for the results for those,
Yes.
for those tests? All right.
How long does it take for results to come back after a test?
The Santa Clara Public Health Lab has a turnaround time of about 48 hours. The commercial labs generally are running 5 to 7 days.
Thank you, guys.
Thank you, Gail.
Yeah.
Yeah. It's good to have the face